Welcome back to another episode of Dance Med Spotlight, where we talk about all things dance medicine and dance science. In case you're new here, I'm your host, Dr. Alyssa Arms. I'm a physical therapist based out of Colorado. I'm a dance specialist, educator, and lifelong dancer. And I wanted to create this podcast, one, from a gentle nudge from a friend of mine who is a podcast pro, and two, to create a bridge over the gap between dancers, dance teachers, dance parents, healthcare providers, and anyone else who is helping to support dancers along the way. I've spent years in clinical practice, higher education, and in the dance community, and have seen how often dancers, unfortunately, can fall through the cracks for one reason or another. And it's not because people don't care, but because systems don't always talk to one another. We don't have great communication across folks, maybe misunderstandings. There are a lot of things that can factor into this. So this podcast exists to help close some of those gaps, trying to create a space for dancer-centered conversations that are thoughtful, that are evidence-informed, and coming from a lot of different perspectives. Over the years and seasons of doing this, I've had the opportunity to sit down and talk with some really incredible people and some folks who have become friends also, which I think is amazing. These are people who have been or are professional dancers and choreographers, physical therapists or physicians, researchers, educators, advocates. All kinds of different people have come on here, and we've talked about things like injury risk reduction, strength training, hypermobility, trauma-informed care, mental health, so many different topics. But today's episode is going to be a little bit different. We're looking back, reflecting on some of the past episodes and highlighting some of them, looking at some of those conversations that seem to have really resonated with those of you who are listening or watching each of these episodes. So what we're going to do is start a countdown of the top 5 of 2025. Talking a little bit about each of the episodes and some standout moments. We're also going to talk about the top 5 of all time, which some of them continue to rank high year after year, which I think is really amazing. And we're going to wrap up with some common themes that seem to have connected across a lot of these different conversations and other episodes that we just don't have time to get into in this episode without it being like a week-long episode. So there's a reason that a lot of these conversations and episodes keep coming back to the top, and we're going to get into that in a little bit. But first, what we're going to do is talk about the top 5 episodes of 2025. At number 5, we have Courtney Adair. This conversation in 2025 with Courtney was our first ever returning guest on the podcast, which is exciting. She is a professional West Coast swing dancer, instructor, and judge with over 15 years of experience and has a really interesting other lens to bring to it with training in trauma-informed yoga and clinical mental health. In this episode, we're talking about trauma-informed dance instruction. What does that mean? How does it show up in real dance spaces? And ways that we can consider it, whether it is in private lessons, group classes, dancing socially or in competition, whatever the case may be. Courtney shared a framework that people found to be really grounding, I think. And one of the ideas that came up in this is the idea that trauma, which can be just about anything, is more of a result of it being too much, too fast, too soon. One of the other things that she brought up is that, quote, power is always in the room. So whether it's something that we can name or not, maybe it's a differential between instructor and student, judge and competitor. There's lots of different ways that we can look at that, a more experienced dancer versus newer dancer. we need to make sure that we're acknowledging that and reminding ourselves of that. And so, small choices in the language that we're using, the structure that we provide within a class can really dramatically change how a dancer feels in that space and whether or not it feels like a safe space or learning space for them. One of the things that really stands out to me in this episode in particular was this idea that everything in dance can be an experiment. And this particularly resonates with me because of an episode that I just recorded yesterday, where we were talking about some of this idea as well, where there's so much that we can experiment with in our dance to help us grow as dancers and understand our bodies, understand the art that we're doing. And in general, it helps us reduce some of the pressure, maybe increase some of our agency and feeling safe to be learning and growing rather than feeling fearful in that space.
Like, if I think about what being trauma informed has helped me to understand on a deeper level, it's that, like, I want to prioritize feeling good in my body.
Mhm.
Yeah, which is not always such an obvious thing. Yeah, that, like, that's actually what I wanna be moving towards, and that's what I wanna be inviting, everyone that I interact with, that they can also move towards feeling good in their body. Um,
Mhm.
yeah, especially, like, in dance. I think sometimes we were like, "This has to hurt in order for it to be good."
Yeah.
Yeah, yeah, and I get really curious about that, and, because for me, like, as a judge, um, my favorite dances are the ones where it's like I'm witnessing flow state, like, I'm witnessing someone feeling really good in their body.
Episode 4, top 4 of 2025 was with Sarah Tyndall. Now, in this episode, we were talking about things beyond physical symptoms and technique, and really focusing more on the full human experience of being a dancer. One of the things that Sarah talked about is how we cannot separate the dancer from the individual person, and how things like emotional load, stress, expectations, and environment can all influence how dancers are moving, healing, and performing. One idea that really stood out was this reminder that support as a dancer is also not just about fixing problems or when something goes wrong. It's making sure that we're building systems, we're building and developing relationships that allow dancers to thrive before there's ever an injury, before they get to a point of burnout. And I think this was a particularly important episode for teachers and clinicians who are just trying to do better, but sometimes working in a less than perfect system, and making sure that we have maybe some of the language and perspective that can honor how complicated it all can be.
That's all I want is just be a part of your network. I don't care if I'm your backup. That's totally fine.
Yeah.
Send me as your backup and give me that opportunity to still work with your dancers. But the bigger that network is, the more likely you are to really care for your performers.
Hmm. Yes. And having that set up before there's a problem. Like I've seen at
Yes.
studios where it seems like all of a sudden there's a rash of injuries. And if that is the time that you are starting to try to find some of those people in your network, it's going to be a lot more stressful
Yeah.
than if you develop that over time and kind of have your list of folks
Right.
for when you do need them.
And I'm totally, like I said, I don't, not every provider you work with, or, whether it's a healthcare or a dietitian or whatever it is, not every person is going to be your favorite, and not every person is going to fit every one of your dancers. So there may be personalities that you can say, hey, this dancer really needs care, but I'm not sure that that personality is going to be a good fit, but I do think this person would be.
Coming in at number 3 is my conversation with Dr. Linda Bluestein. Dr. Bluestein is one of the leading voices in hypermobility and connective tissue disorders. And so this has continued to be a frequently shared episode for dancers and providers who are trying to just better understand bendy bodies. One of the things that I think is an important reminder from this episode is this idea that if you've seen one person with something like Ehlers-Danlos syndrome, you have seen one person with Ehlers-Danlos syndrome. Sure, we may have some patterns, we may have some common things that come up for folks, but its true presentation and all the facets of how it presents, how intensely different facets present, is so incredibly individual. And so it's important that as we're working with these folks as providers, if we are instructors or studio owners or choreographers working with these dancers, that we realize that there needs to be an individualized approach for it, for the individual that is in front of us. That means individual care, making sure that we have individualized strength training programs and other medical and fitness and wellness support, and getting a better and deeper understanding of how these types of bodies function, not just in dance, but in the world. This episode, I think, really resonated with folks because people who have a diagnosis like hypermobility, Ehlers-Danlos, connective tissue disorder, can often feel misunderstood. They can go quite a while before they get the diagnosis or they get any answers or support. And so it can feel validating to hear about some of this. And it also helps give providers a clearer framework on ways that they can provide some of that support.
So the core features that we want to think about, three things. It's hypermobile joints. So again, that greater than expected range of motion. We see changes in the skin. So we see stretchy skin. We see abnormal scarring in the skin. So like say you have surgery and afterwards the scar, instead of being a nice thin, narrow line, it's kind of wider and it's also a little bit thin in the middle. If it's really papery, then we want to be thinking about the classical subtype. But if it's just wider and a little bit thin depth-wise, then that could be consistent with the hypermobile type of EDS. And then the third thing is tissue weakness. So we see things like pelvic organ prolapse, even in people who have never had a baby. So that's something that is pretty unusual. So basically, the pelvic organs are starting to come down where they shouldn't be in the pelvis.
Mhm.
So we see things like pelvic organ prolapse, we see ventral hernias or abdominal hernias, and other tissue weakness. So if we see those three kind of core features, that's when we really start thinking about hypermobile EDS.
Number 2 is my conversation with Maria Haralambis. This episode focused less on individual bodies and how they function and more on some of the systems that surround dancers, whether it's education, communication, access to care, and the environments that we have in studios, in schools, training programs, classes. Maria really provided some great insights on how dancers don't need more pressure, they don't need higher expectations placed on them. They need better support, clearer communication, systems that actually reflect what we know about health and what we know about learning. This was an impactful episode because it really acknowledged how hard it can be to create change, especially within, again, some of these less than perfect structures, but still offering hope and offering practical ways to move forward.
You're still honoring like the dance style and like keeping as many traditions as possible, but you're also like you're kind of blending it with your needs at that period of time, right? And it's also just frustrating to hear that there's still teachers that are just like, well, if you tell them that like that example that you just gave, if they're just like, well, you have to put your arm here, and it's like, well, just like even as an adult, I think that's like shocking that you still hear that just taking adult classes.
The number 1 episode of 2025 is my conversation with Galit Friedlander. She is a professional dancer and choreographer. She's also a personal trainer and host of her own podcast, Dance Speak. This episode, I think, struck a chord because it really bridged the idea of artistry and physical preparation. She emphasized that there's not just one way to prepare your body for dance. Things like strength training should be adding support and some ease of movement, maybe allows your body to move in different ways than your dance training is asking you to do, but it is not meant to take away from the art at all. I think one sort of quote or moment that stands out from this episode for me is this idea that dancers really are the experts in dance and they're able to build some bridges. That perspective was helpful, I think, for dancers and providers, healthcare providers, folks in the fitness world, especially if they maybe feel misunderstood or really kind of stuck to some of the more traditional training models, knowing that we need to approach dancers and the way that they're training in a different way. This conversation continues to resonate because it respects dancers' autonomy and still advocates for sustainable and evidence-based training, which is really important.
I think educating dancers on, first of all, just like what do we do and what do we not do? Because often dancers do not know who they should go to for their ache and their pain. And even saying, like, if you're not finding it here, you might find it over there. Like, if you don't find it with this type of profession, you might find it with another. I like doing that with like around personal trainers and telling people, like, and I mean it, you don't have to train with me. Even if you don't, like, I want you to be empowered and equipped with knowledge to find an excellent match of a trainer. So I think even just knowing, like, what does an osteopath do? I don't know. What does a chiropractor do? What does a physical therapist do? What does an internist do? What does at what point is it emergency? At what point might you want to consider seeing one of these specialists? Because what you know is that that little ache and that pain that the dancer is going to push past should probably be seen way sooner.
So as we wrap up the top 5 episodes of 2025, I want to pause for a minute because when I'm able to look at some of the data around the podcast over time, there's something interesting that happens. There are some episodes that spike right when they release and then fade away just as quickly. There's some that maybe stick around a little bit for a particular season, a particular moment that's happening in the dance world or dance medicine and science world. But then there are others that really never leave the conversation. These are ones that people continue to search for, send to colleagues, share with students. They come back to when maybe they're facing something familiar again. Maybe they're facing pain or injury, burnout, uncertainty, trying to figure out how to better support dancers that they're working with. So a lot of the guests that we just heard about from the top 5 of 2025 also appear again in the top 5 episodes of all time. And I think that that overlap is important too. It's not just that these are the right conversations at the right time, but perhaps these are some of the ones that will become foundational ones. So let's talk about the top 5 episodes of all time, the ones that continue to rank in the top year after year, or maybe joining them for the first time this year. So at number 5, we have Courtney Adair, my double guest from the podcast. That said, it's from her original episode in 2023. This was one of the first episodes of this podcast. And I think that it was an important one because it helped lay some of the groundwork for discussions that came up later, where we were talking about things like identity and power, how dancers show up on and off the dance floor, in practice, in competition, and just in life. Number 4 is Dr. Linda Bluestein, where this really can be a cornerstone resource for folks wanting to understand more about hypermobility, connective tissue disorders, and more specifically, Ehlers-Danlos syndrome in dancers. At number 3, we have Maria Haralambis, a good one because we're talking about the system level lens and having some honest discussions about what sustainable support can look like and maybe what it requires as well. And number 2, Galit Friedlander, where we talk about honoring artistry while still advocating for strength, autonomy, and longevity. What does that look like in combination? And the number 1 episode of all time is my conversation with Chantelle Pianetta. This episode consistently resonates because she spoke directly to ideas like pressure, identity, sustainability in high demand dance environments, and offering language that a lot of dancers maybe didn't know that they needed. One of the things that I think is also exciting about Chantelle, not only is she a world recognized West Coast swing dancer, but she also was just recently promoted to a principal dancer with Golden State Ballet. So congrats again on that promotion. When we look at these episodes all put together across the years and seasons, the guests, the disciplines, the topics, there are a few themes that start to come out and become a little bit more apparent. I think one of the first ones, and maybe really important one, is the body is not the problem. Things like pain and injury, hypermobility, fear, shutting down, burnout, going above and beyond in effort. These are really intelligent adaptations that our bodies or brains can come up with, but it is not a sign of failure on the dancer's part. Secondly, power and permission matter. So whether you're a teacher, a clinician, choreographer, mentor, power is always present in dance space, but it's how we use it that shapes how safe dancers feel in their bodies and how they move through the world as a dancer and as a human. Third, feeling good in your body is not the opposite of excellence. So many times across episodes, and not just in the ones that I mentioned here, guests have reminded us that things like being in a healthy state, promoting longevity, promoting high level performance, all of those things start to come out when the dancer feels supported, regulated, and respected. Let that sink in. And finally, collaboration beats competition every single time. Dancers are always going to be best served when teachers, healthcare providers, educators, artistic directors, competition owners, whoever it is that we're talking about in this space, come together and work together. They share knowledge, they build bridges, they recognize that no one person can or should do it all. So these are the conversations that continue to come to the top because they reflect what dancers and the people who support them are asking for, and they're asking for it now. So thank you for listening. Thank you for sharing episodes. Thank you for being a part of this community. This has been another episode of Dance Med Spotlight. I'm Dr. Alyssa Arms, and I'll see you in the next episode.
Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.